You are tuning in to Dominica Giovedini, the Director of Development and Communications at Rams Inc. And during the month of May, we are going to be celebrating some of the stories that have contributed to Rams's development and those who have been affected by the organization. In the month of May, it is both API Heritage Month as well as Mental Health Awareness Month. And so with that conjunction, we'll be speaking to some of the experiences of past employees, current employees, interns, and clients. So today I am here with Mory Chhom, who is a current employee of Rams, but I am going to let her introduce herself and give us some information about her backstory. Take it away.
Hi, my name is Mory Chhom, and I am a Cambodian American. My family is originally from Cambodia. However, because of the war and genocide in Cambodia, I was actually born in Thailand in a refugee camp, and we resettled here in 1981 with many, many other Cambodians. The community and neighborhoods that I lived in had a lot of us. There were a lot of us, and our parents were monolingual. And unfortunately, the systems that we were receiving services from were either not aware of our collective trauma, as well as the individual trauma that was faced during genocide. And so the services that were offered did not really include mental health. It did not include services that are culturally and linguistically appropriate. I remember growing up and having to cut class in middle school so that I could attend a doctor's appointment with my mom. And at the doctor's appointment, I remember her feeling really timid with her interactions with her doctor. And her doctor, instead of understanding her history and her past and treating her with care and kindness, it was very authoritative. And also there was mentions of why she's living in a country and didn't speak the language. And at a really young age, it hit me. And I thought, oh my gosh, how insensitive. And how is my mom going to do better when she's so afraid of like her doctor? It didn't feel like a two-way exchange. And so for many, many years, my community navigated through various systems of care without appropriate service providers. And I somehow found the field and the focus of public health. And I thought, okay, this is my opportunity to really influence various policies and providers to raise awareness of not only my community's needs and our history, but as well as other communities who are similar as far as needing culturally and linguistically appropriate services. Yeah, and so my work has been in community health for many, many years. And then fast forward to 2023, I'm here with Rams.
Yeah, so speak maybe a little bit more about your professional journey from that personal experience and then your experience at Rams.
I feel like I was very privileged in my undergraduate studies. We got to go out and work really closely with various low-income monolingual communities. And in our work with the communities, there was a lot of involvement from the parents of monolingual students and their guidance to help inform what was right for them. So they led They led a lot of the the topics and the information that we received as students, as undergraduate students. And that was when it kind of clicked in. I had an aha moment. It clicked in my mind when I saw the successful outcomes of engagement with these various communities, how much they showed up, how much they participated, and how much they got out of it. And it was all health education. Health education that was, the topics were chosen by the families. And then we worked collaboratively with various classmates who spoke the languages of these communities who were monolingual. Um, and it kind of solidified my career goals, as well as my academic goals. I went on to doing more education and studies in public health, but also was very intentional about the jobs that I was doing, to making sure that whether it was advocating for low income, poor, um, invisible communities who were monolingual, or if it was working closely to develop health education materials that would resonate and be responsive culturally and linguistically. Um, I did some work at the national level where we worked really closely with, this was my first job out of undergrad. I was the program assistant for a nonprofit uh, national organization whose goal was to advocate on behalf of community health centers and FQHCs, the federally qualified health centers, whose main population were low income Asian Americans, Native Hawaiians, and Pacific Islanders. I was at this job for about 4 years, and we worked closely with various community health centers and FQHCs to ensure that the programs and services were really client-centered, looking at what the needs of the patients were and meeting them where they're at. And so it moved away from a medical model to a client-centered model, because the outcomes were greater and the impact was greater. And then after I graduated from graduate school, I moved to Cambodia and I taught at the university level to second year undergraduate students. And I took what I learned in my academic training and wove it into the curriculum that I developed with the university students, really giving them the opportunity to really dive deep and look at all of their various strengths and assets of their household, of their families, and of their villages. Because many of the students receive scholarship to go to the university, and it was really about uplifting the various ways that they practice health. And so instead of looking at their communities and asking what's wrong with my people, it was always, how are my people taking care of themselves, and how can we raise awareness on these various health practices and cultural healings. And when I came back from Cambodia, you know, I feel very blessed, because while I was able to teach the students, I also learned a lot about supporting the facilitation of self-empowerment. And so you see how being able to lift up an individual or lift up a community, um, uh, it is not only positive and conducive for health and wellness at the individual and community level, but also it continues to inspire and motivate these the idea of strength-based approaches. And so when I came back from Cambodia, I had the opportunity to work serving a population that was near and dear to my heart, which are the Southeast Asian communities. Um, I was blessed to get a job as the health and wellness program manager for one of RAM's community partners, the Southeast Asian Development Center. And through that position, I was able to witness the benefits and the advantages of community health programs that really work closely with the communities as the experts, and having them inform and design their programs so that it is a good fit for their respective communities. I was there for about, I want to say 4 years, but one of the most, I want to say memorable or successful programs was the behavioral health programs. And it was really because of the intentionality behind letting the community partners know that they have the freedom to design and implement various activities and deliverables that make sense to the community that they serve, while being able to weave in the therapy and the counseling and the Western ways to heal socially, emotionally, and mentally, but also recognizing the advantages of the Eastern practices. And so many of us don't think about spirituality as healing, but for many of the Southeast Asian communities, our religion and our spirituality has a lot to do with our social, emotional, and mental health outcomes. So the program that I got to manage was actually through a RAMS partnership. And at the time, Natalie Asun was the program, I think, manager. This was maybe 5 or 7 years ago. And she said, hey, there's this opportunity for you to help meet the mental health needs of your community. And this is going to be designed by you all and led by you all, so that it could authentically be with the intentionality of community members being able to have service providers that look like them and speak their language.
So we kind of got the introduction to how you were introduced to RAM. So how about a little bit, so you work with us now. So how about a little bit more information of where the position you are in? Because I know it's kind of been a reimagined position recently, and what that means to you, why it's important, and how you see things kind of going forward.
Yeah, I think that this position and this division at RAMS, population focus, is so important to me because it really is not working with communities in a way that is a prescription. So I don't say, this is what I want you to do, and this is how you should do it. But it's more about trusting that the community leaders who are designing and implementing this with their team members, with their respective agencies or organizations, are the experts. And with population focus, as you know, it works with some of the most historically marginalized and invisible groups. So we're talking about Pacific Islanders, Samoans, Tongans, and many others who historically have always been lumped with Asian Americans. And although there's the acronym PI after A, when we say AAPI, it often isn't reflective. And when I say this, I mean the needs and the resources. We often hear a model minority, and oftentimes, I myself, as Southeast Asian, when I hear somebody say, "Oh, you're a model minority," I laugh because all throughout high school, um, I didn't even have guidance counselors to encourage or inspire me to go through higher education because they had already had in their minds that I will be another statistic. And so uh, I was not introduced to higher education. I was told that I'm gonna be pregnant and be a beneficiary of a government assistance. Um, and so were all of my other peers from the Southeast Asian communities. And everywhere we went, people would say, "Oh, you're good at math." And we thought, no, it's actually not that easy for us. We're trying to support our lives in our household. We're trying to navigate being Cambodian, but also American. And so there was a lot, it was very multi-layered and multifaceted, the various barriers and challenges that, and the different intersectionalities of our identities, where we thought we aren't those successful Asians that everybody is talking about. And so population focus works with community-based organizations that are working with some of the most underserved communities. In addition to Pacific Islanders, there's also the Filipinx community, as well as Cambodians and Lao and Vietnamese, among others. But I am hopeful because of this opportunity for us to collaborate and engage with our community partners. We work alongside them to hear about any challenges and any barriers and work closely together to try to address those, but also get to witness the successes. When you hear that a community member is doing much better socially, emotionally, mentally, as opposed to last year, that says something. That's an indicator of how well these programs are doing. And I think that our communities oftentimes, it's always word of mouth when we hear about services and resources. Information gets passed from one community member to the next. And over the years, the services through this community offering has been expanded to even the East Bay, to serve the Pacific Islander community. And the Pacific Islander communities, there's a lot of members, because if you think about those from Fiji, those from Tonga, Samoa, there's so many that are residing in the East Bay area, but for so many years have kind of piecemealed their services, if they get access to mental health services, prevention and early intervention. But because of the Pacific Islander Wellness Initiative that is under population focus, many of the mental wellness needs are met for this priority community and population.
Awesome. Well, I think you kind of brought it full circle there. From my vantage point, I think that Rams, it kind of even goes beyond the linguistic services and the culturally appropriate services, which are absolutely there, but it even takes it a step further to say, to go into a community and say, you tell me how you achieve wellness. And we can kind of work around developing programs. I think that's a really powerful way for community-based programming to be successful, is more of a, hey, you tell me what's gonna be the best. And that's kind of what you were speaking about when you were teaching in Cambodia, really just helping people embrace really the protective factors or what's working instead of focusing on what's not working. So I think that's a great progression. So did you have anything else that you wanted to share before we sign off?
Um, you know, as you know, Dominica, I'm a newer staff to Rams, and so I'm grateful having been once upon a time extremely poor and barely speaking English, but helping my parents navigate. I'm grateful for the ways in which Rams comes through for our communities. And I think that the more that we can actually sit down and listen with an open heart and an open mind with intentionality to really say, hey, I am your ally. I stand in solidarity with y'all. You let us know how you envision full health for your communities.
Awesome. Well, thank you so much for sharing your story today. And we look forward to the future of Rams.
Thank you.